Opalescence Boost is for patients that want a whiter smile fast. This in-office whitening treatment is the answer. Approximately an hour to an hour and a half appointment is all that's required for the most brilliant whitening treatment available on the market. Opalescence Boost is a welcome alternative to other in-office bleaching systems. Boost whitening relies on a simple syringe-to-syringe chemical activation, as opposed to the expensive and intimidating light systems normally suggested for in-office whitening procedures. The powerful 38% hydrogen peroxide formula is not activated until used in the office and contains potassium nitrate and fluoride, which has been proven to reduce caries susceptibility, lower sensitivity, and improve the micro-hardness of the enamel. The distinct red color of the formula facilitates proper placement and complete removal. The mixing occurs via a novel jet mix and syringe-to-syringe mixing, which assures the formula is always fresh and at its best just before delivery. Any mixed product that is left over from the treatment must be refrigerated and is good for 10 days. Opalescence Boost is a 38% hydrogen peroxide power bleaching gel. The distinct syringe-to-syringe mixing ensures freshness for every application. Once chemically activated, the gel can be used to effectively whiten teeth in about 1 hour. Less time is required for mild stains. More difficult stains may require additional treatments. Opalescence Boost is applied as follows. Begin by placing self-supporting plastic cheek retractors. Place a tongue bite block in the molar region and instruct patient to hold in place with gentle but firm biting pressure. Ultradent recommends using the isoblock or prop guard. Completely rinse and air dry teeth. Apply a 1 to 2 mm wide barrier of Opaldam on the gingiva. Seal the interproximal spaces. Overlap the resin approximately 0.5 mm onto dry enamel to seal. Extend the resin 1 tooth beyond the last tooth to be bleached. Visually check that all gingival tissues at the resin margin are covered and a seal is established. Light cure the resin approximately 10 seconds per tooth. To mix the activator with the bleaching agent, ensure the red and clear syringes are securely attached together. Quickly and forcefully press the clear plunger into the middle clear barrel. Using your thumb, press the chemical from the red syringe into the clear syringe. Continue by reversing this action. Mix a minimum of 20 times rapidly, 10 times for each direction or side. Press the entire mixed contents into the red syringe. Remove the clear syringe and dispose. Twist a 20-gauge micro FX tip onto the red syringe. Check material flow on cotton gauze or a mixing pad to ensure evenness of flow before using intraorally. If resistance is felt, do not proceed. Attach a new tip and test again before using on the patient. Apply a layer of Opalescence Boost bleaching gel approximately 1 mm thick over the labial surfaces. Extend the gel slightly onto the incisal or occlusal edges. For optimum effectiveness, stir or agitate every 5 minutes. Leave each application of gel on the teeth for 15 minutes and remove the gel using suction only. To prevent Opalescence Boost from splattering onto the soft tissues, do not use water to rinse during the initial suction. Ultradent recommends using a Luer vacuum adapter with a Sergi tip. Use caution not to dislodge the resin barrier. After all visible gel is removed, follow with a gentle thorough rinse. Direct the water toward the incisal edge while using high-volume suction. This process may be repeated up to 6 times unless the patient becomes overly sensitive. Evaluate the shade change after each application. The cured Opaldam resin is quickly and easily removed in 1 or a few large pieces. The total procedure typically lasts 60 minutes, with 3 to 4 applications occurring. If additional whitening is desired and no significant tooth sensitivity is observed, schedule the patient for repeat treatment at least 3 days following the initial treatment. Be certain to read the product instructions, warnings, and information for the patient contained in the package, and advise the patient accordingly. Most all clinicians who provide in-office bleaching follow up with tray bleaching. This assures bleaching further distally in the arch and/or to achieve ultimate level of whitening. An office can choose to make a custom tray for the patient to use as a follow-up or use the preloaded Opalescence Tray White Supreme tray as they require no additional impressions, models, and lab time. Over half of surveyed dentists report that patient demand for in-office whitening has increased over the past few years. The same number of dentists report that their patients are very satisfied with the results of their in-office whitening. The reality is that today's media promotes immediate results when it comes to whiter teeth. Whether it's an upcoming wedding, a business meeting, or simply an important date, many of your patients will want the quickest path to a brilliant white smile. And you'll want to inform them of the benefits of using Opalescence Boost. Many in-office whiteners require a rubber dam, a whitening light, or both. Rubber dams can cause bleeding, and whitening lights can burn or irritate soft tissues in the mouth. When Opalescence Boost is used with Opal Dam Gingival Barrier, the need for uncomfortable rubber dams is eliminated, and the clinician attains quick and easy barrier protection. In addition, Opalescence Boost has never required a light for activation. Because Opalescence Boost is chemically activated, you won't need a light to activate the chemicals, and your patients won't be subjected to the sensitivity or dryness that can be associated with the hot lighting system. Other manufacturers may use whitening lights, which may serve more as marketing tools than anything else. People see light-activated whitening products on TV and assume that all effective in-office whitening treatments must use a light. The reality is, however, Opalescence Boost creates the same brilliant results without the expensive and intimidating light. By eliminating the rubber dam and the lights, you and your patients save time and discomfort. Best of all, Opalescence Boost is a less expensive whitening solution. There's no need for bulky, intimidating equipment, and there are no extra pieces or parts that come with the in-office whitening process. In-office whiteners come in a variety of concentration formulas. The fact is, different concentrations typically dictate how long the material should be used. With 38% hydrogen peroxide, Opalescence Boost offers one of the highest percentages available for in-office bleaching. This means that each application of Opalescence Boost only needs to be applied between 10 and 20 minutes. Opalescence Boost also includes PF, which has been proven to reduce caries susceptibility, lower sensitivity, improve the micro-hardness of the enamel, and improve enamel health.